This is Dr. Kate Eckert, and we are Form, Function, and Flow Lab. We have offices in Oil City and Grove City, Pennsylvania. I am doing a series of podcasts on different conditions that we treat with our new therapies in the office. So we have Shockwave therapy, which we have EE Shockwave, and a class for laser. We also have decompression. Typically we use decompression for the spine. We have used it for knees occasionally, but typically we do not need to incorporate decompression because we can get very good results with both shockwave therapy and laser therapy. So knee pain is sort of general. The types of knee issues that we've done are kind of all over the board. We've often had people come in and say they had consulted their orthopedic surgeon and were told that it is bone on bone and that they need a knee replacement. They are not wanting to do surgery right away, so they come to us hoping that we can find something to help them. Often we have found that even with just standard shockwave therapy, we can address those calcifications in the muscle, tendon, ligament, and around the joint, and be pretty successful at getting them some pain relief and giving them some time before needing a replacement. Recently, we went to a seminar that taught us how to use the shockwave therapy at a deeper setting to address circulation within the bone itself, and that helps stimulate better cartilage growth. So very huge development in helping with that bone on bone issue. So we would treat all the soft tissue around the knee first, and then we would go in and do we call it the medullary space of the bone. With shockwave, typically we're looking for those areas of calcification, and you can feel them. So for the soft tissue areas and on that surface level bone, we are looking for dull ache, and that tells us we're in the right spot, we're treating the right area. Healthy tissue, you typically do not feel the sound waves going through unless you have something like neuropathy. And when it hits an area of calcification, it feels like a deep dull ache, and that tells us we're in the right area, and that's what we want to treat. We have you let us know when it feels like a 4 or 5 on a scale of 1 to 10, and then we stay in that area until it starts to come down, and that tells us that we're working through that area of calcification. And then we, keep finding more spots. That's how we would treat the knee in general. And if we did know that you had a bone on bone issue, we would want to, see the x-rays. Is it on the inside part of the knee or the outside, or both? And we would use a deeper pad. When we're doing that surface area, we're using a thicker pad, and that's telling us how far into the tissue that it goes. So if we wanted to go all the way into that medullary space, we'd pick a deeper pad. The sound waves mostly treat at the apex of where the shockwave happens. So we would, pick according to that. And because it is going through the periosteum, which is what hurts when you break a bone, and hitting the medullary space, it's not going to feel like that deep ache where we feel it everywhere else. We are wanting to have that pain-free sensation because we're just trying to increase circulation in that medullary space, and it doesn't have a lot of pain sensors in there. So we would do that and hope for better cartilage growth. Again, not an instant fix. It takes a while for that turnover to happen. So that's how we do the degenerative kinds of issues. And we would also incorporate laser therapy, because laser is decreasing inflammation and also increasing circulation, just in a different way. So before I ever had the shockwave machine or the laser therapy machine, I took my 13-year-old lab to get his hips and knees lasered at the vet. So same idea, they're trying to decrease the inflammation in the joint, increase circulation, and really help those arthritic joints. So we do similar thing. We also incorporate laser into knee recovery if it's post-surgery and you're having some swelling still, or little micro tears that they don't want to do surgery on that's causing swelling, those kind of things. So laser and shockwave paired together really works well for the knee. There is a fine line between too much of a good thing is a bad thing. So, you know, sometimes knees are a little tricky and we might use too much laser or too much shockwave, and you might have some soreness, a lot of soreness and a little bit of swelling. Again, it's that tipping point. So it's a trial and error at first to find what your body responds the best to. Typically, we start people off at that 6-week range because we want to see if they're getting that cell regeneration benefit at that 1.5 month mark. And then, you know, if you're starting to feel better for a few days and then the pain comes back, that means it's working. That means we're on the right track, we're on the right path, and we want to do a few more weeks at least of care because you're having good response and it's just going to keep getting better. But we want to get it fully feeling 100%. And then that cell regeneration is still going to happen at the tail end there, and you're going to be pretty good for a while. We have seen good results with Baker cysts, which typically aren't well treated. That's a thing on the back of the knee. Shockwave is good for that. Then laser follow-up helps with the decreased inflammation. So arthritic knees, bone on bone, micro tears, recovering from surgery, Baker cyst. We even do shockwave and laser on people after they've had knee replacement. If you've had a knee replacement and you are still having swelling or you're having trouble getting that full range of motion again, we've seen, you know, good results with breaking down the scar tissue that's created in surgery and helping restore that full range of motion. So, you know, there is, you know, new knee hardware in there. And if we were doing something like ultrasound, which is also sound waves, we would not be able to do ultrasound because it's all these little waves that are super close together. And because they're so close together, they create heat. And you don't want a hot metal thing in your tissue. Shockwave you can do with it because it is a giant wave, and that's that giantness of the wave is what breaks down the calcification and stimulates cell regeneration. So it's a giant wave, a pause, a giant wave, a pause. So because they're spaced out, we don't get that heat generation, and because it's so big, that's what causes the cell regeneration and the breakdown of calcification. You're not going to cause cell regeneration or break down anything with ultrasound. It is a, you know, can be a therapeutic thing, but they're both sound waves, but it is very different in the treatment and outcome. If you have any questions on knees, feel free to reach out. We treat knees every single day in the office, and we look forward to helping you.